the Health, Human and Social Services Committee meeting to order. And first on the agenda is approval of last month's meeting. Motion made by Supervisor Loeb, seconded by Supervisor Bramer. Any additions and corrections? If not, all those in favor?
Aye.
Opposed? Carried. Just a minute, please. Oh, did I forget?
Oh, no, just the microphone.
Yeah, I noticed that. All right, with that, I'll turn it over to Chris.
Good morning.
Good morning.
I just had a couple of items. The first one is a request to amend the county budget to add grant funding. There was additional dislocated worker funds available that the Workforce Development Board applied for. We were expecting to get the award on Friday. We didn't get the actual award yet, but it is expected any day. The amount is $40,920, and the breakdown is shown on page 2. I want to thank the county administrator for picking up an error. Under item B, the appropriation code, the last item, WIOA admin hospitalization, that should read $324. That was a typo. It's not $8,000. It should be $324. There's actually, two separate amounts, $37,200 in dislocated worker funds and $3,720 in administration.
What is the hospitalization for the top piece for the dislocated worker?
That one is $7,937.
I think you might still be a little bit off, but let me do my numbers. We can come back to it if you are.
Okay.
I think, Madam Chair, I think if this was the federal government, we would have left that at $8,500.
Thanks.
Yes.
All right, would someone like to make that motion? Well, our administrator's checking the figures. Right.
I will move it, Bramer.
I'm sorry.
Monday
Seconded by
morning.
Supervisor Leggett. Any discussion on that? All those in favor?
Aye.
Opposed? Carried. All right, thank you.
And then the second item is to add a new member to the Workforce Development Board. The President and CEO of the Adirondack Regional Chamber is traditionally a member, and once Michael Biddle was appointed President and CEO, we had conversations about having him serve on the board.
All right, Supervisor Sokol, seconded by Supervisor Leggett. All those in favor?
Aye.
Opposed? Carried. Thank you.
And then I had a information item, the summer picnic. Traditionally we hold it on a Thursday. This year it will actually be on a Friday, and I realize it's the same day as the Board of Supervisors meeting. The picnic starts at noon. Hopefully you'll still be able to get out and get down and see the kids.
It's a nice function, so I
Yeah.
would encourage any of those of you who could to make it to that. It really is a very nice program.
And we'll send out invitations when we get those put together.
Okay, great. Thank you. Anything?
My numbers holding steady, Ryan?
I'm double checking it.
Okay. I didn't want to leave until...
Until we're sure where our numbers were right. Good. Do we have anything else? Any questions that the committee might have? Supervisor Leggett?
WIOA stands for?
Workforce Innovation and Opportunity Act. Yeah, sorry.
Yeah, I'm getting a grand total of $40,668.
I didn't bring my backup calculation spreadsheets with me. I'm sorry, 40,000 what?
668.
Instead of 920.
Yeah.
We could do a clerk's correction when we figure out.
Let's
okay.
do that. We'll do
All
the
right.
clerk.
All right, we'll just do the clerk's correction when we figure it out. Okay.
They'll fix it for finance. She said
Okay.
it will be all set.
Great.
Okay.
I'll get you the correct numbers as soon as I get back to you.
Thanks, Chris.
Sorry
Okay.
about that.
Thank you. Is that it?
That's all I have, Chris.
Okay. Thank you very much. Have a nice day, Chris.
Good morning, Rob.
Morning. How are you?
I got one.
super great weather. Yeah, spent all day.
That's right.
Saturday,
I know how that is.
hanging out.
This is Whit Lake?
Racket Lake.
The mineral content of Racket Lake is so high, you can float on your back. I can float on my back with my hands like this,
Oh, yeah.
and my feet and my belly are...
My dog figured out.
It's amazing, it's higher content
And
of the
waiting for you to
ocean.
drop something.
I don't know what it is, it might be iron.
Yeah, it's not because
I don't know, but it was like, it wasn't very deep, so
love to
I
bring
didn't do
it.
much floating.
We're all
You
set,
just
Rob.
wade around, the kids.
Good morning, everyone.
Morning.
Morning.
So I just have one item. I initially thought when I sent out the materials this was just going to be an informational item because it didn't quite have the level of detail that I wanted to bring forward a resolution request. But late on Friday, I did get a call from the New York State Senate about this funding. So let me go ahead and introduce it, and then I'll explain. So I'm requesting a 2018 budget amendment to request to allow for $185,000. This is from the New York State Senate. What this funding is called it's called Joseph P. Dwyer funding, and it's to develop a veterans peer-to-peer program in Warren and Washington counties. There's some backup information here that I've included, a handout that tells what these programs are all about. But basically, the New York State Senate, a number of years ago, 2012, I believe, was the initiation of this. They started with a handful of counties. Member money, earmark this, put it out to the counties to develop the veterans peer-to-peer, recognizing the impact for returning veterans of trauma, and the importance of connecting to peers, for help. So what we would do in Warren and Washington is I would work very closely with the veterans service agencies. So Denise DiResta has agreed to be part of the planning for this. Ken Wenchel from Washington County is going to be their new director of veterans. We're also working with Cindy Roberts, who's a Gold Star mother from Warren County. You may know her. She lost her daughter, Sergeant Christy Roberts. In fact, the bridge over the walkway or the bike path there at Route 149 is dedicated in her honor. We have a planning committee we're putting together that includes some other veterans representatives, like from the Adirondacks Vets House in Glens Falls. We're reaching out to the VA. We would have somebody, or offer to have somebody from Senator Little's office on the committee as well. If there's anybody from the board that would like to be on, I would certainly welcome that. At this point, the level of detail that I didn't know is that I don't know specific budget codes yet, like where we're going to put this money or where it will be expended in terms of the expenditure codes. I feel fairly certain, I talked with Amanda on Friday afternoon, I feel fairly certain that I can at least get the revenue code identified so we can receive the money, park the money, and then come back with a plan, probably together with the Veterans Director, as to what we want to do with the funding.
All right, so right now, just you need approval of this request.
I just want to be able to accept the funds, yeah.
Go ahead.
Could I ask you, do you know whether it would be your intention to hire a full-time employee, part-time, or have a contractor do this?
I think it might make more sense to keep it in-house this time. We usually do everything by contract, but whatever we do, it needs to be very closely associated with the veterans. And so I could see a living in the Veteran Service Agency. But again, those are decisions still to be determined.
So your proposal would be to just amend the budget now to put the 185 in, and then somewhere down the road we would do transfers once you realize how you want to structure the program? The 185 is the full calendar year amount?
Full calendar year amount. And as far as we know, it's ongoing funding. The counties that were started in 2012, and then each year they've added new counties, a new handful of counties. All the counties have continued to receive their funding.
All right, any question? Well, I need a motion, first of all, granted for Supervisor Loeb, seconded by Supervisor Leggett. Any questions from the committee? Supervisor Bramer.
How many veterans do we have? Do you know? How many in our county?
I don't know.
Denise could probably tell us
Yeah,
that.
yeah, we should
Right.
have her come.
Any other?
I think it's a great program, reading through it, and in answer to your question, Supervisor Raymer, I've been working closely with Justice Martin Apperdew to bring into fruition the Veterans Court, which many of you recall Dave Strainer was pushing for that back 4 or 5 years ago. All the judges are in support of that, but it turns out that there are just not enough veterans in Warren County. So one proposal was to have a tri-county, northern Saratoga, Washington, maybe Hamilton. Essex County has a Veterans Court. They don't know how that got through, but because there probably aren't enough veterans there either. But they have one. But a multiple county, that would require legislation. So in the short run, they want to have something along the line where a veterans emphasis, where the judge says, and it's tough to get veterans to admit that they're veterans, even when they come to court. The idea of the Veterans Court is that veterans have particular issues oftentimes, which lead them down paths that don't always have desirable outcomes. So based on those issues, the treatment and penalties and actions taken by the judge would be different than they would be for someone who wasn't a veteran. So Justice Apperdew's feeling was that there are things that the judge could do to direct the veteran. A Veterans Court will meet at a particular time and they'll have the services right there. But Justice Apperdew's feeling is that the judge could say, you're a veteran, this is what we need to do. Here's a number for someone who could help you with this particular problem. And what he would like to do, and he's checking with all the other courts, but he says, here's the number. Do you have a phone? No. Would you like to borrow my phone? How about if we go over there right now and we'll call this person together to help this veteran through? So I think this program is fantastic, and it'll tie in with the veterans program that we're trying to get established in the court system. And I will, if anybody has any ideas, one thing we're lacking, besides they haven't put it together, is a name. Everything has to have a name. It's not a veterans court, it's not a veterans track. Something that that veterans can identify with and associate with the court system. So if anybody has any ideas along that line, please let me know.
Thank you, Bill.
Thank
I
you.
appreciate the work that you're doing on that. That's
Thank
great.
you.
Anyone else have any other comments? All right, all those in favor?
Aye.
Opposed? Carried. All right, thank you very much, Rob.
Thank you, Rob.
Have a good day now.
How you doing? Thanks.
Trying to keep them
Get her information.
We can pass, we can pass.
All set, Chris?
Morning, everyone.
Morning.
Good morning.
We have some requests for resolutions here today from DSS. The first one is a request for continuation of various contractual agreements for special delinquency prevention programs for this year. And the funds are allocated annually to provide these preventive services for youth and families. If you see attachment 1, you can see there's more details on there. And on the back page of attachment 1, you can see the breakouts. This contract is reimbursed 100% by the New York State Office of Children and Family Services and provides for alternative sentencing, home-based parent education, youth and family counseling as well. The providers are Warren Hamilton County Action Committee and Catholic Charities of Albany, and Catholic Charities located in Saratoga Springs as well.
All right, would someone like to bring that motion to the floor? Supervisor Sokol, second by Supervisor Loeb. Any discussion? Ms. Bramer.
Thank you. Since Supervisor Wild is not here, I'm going to bring up the point that it's June, and these are contracts that were supposed to have started in January. Why is that happening? His comment on Friday at the full board meeting was that we have these like last-minute requests to extend contracts when we have no time to really consider them, and this one is not even at the last second. It's 6 months into the year.
Don't forget, he didn't take over till April. So if this should have started, I mean, we
True.
got to give him a little
That could be
leeway.
part of it, and if that is, that's just something we need to keep an eye out going forward. Like, let's
Yes,
have
certainly.
these
I appreciate
in
your
December.
As Chair
Thank you,
Frazier just
Chairwoman.
I mean, you
mentioned,
can't do something if
this
you're
was
not there to get it.
something before I came on board, but I certainly appreciate your concern, and I am working very closely right now on a number of contracts with our legal and with fiscal manager Julie as well to make sure that these things are done in a more efficient and timely manner. So,
Great.
thank you.
Thank you.
We appreciate that, Chris. June? Yeah.
Chris absolutely promised me that contracts would be one of his priorities as commissioner. So I'm holding it to it.
Okay, very good.
I can get up and running.
We'll leave that up to you, Julie, then, to keep him on
Oh,
track.
I'm on it.
Okay. All right.
That she is.
Keep it going.
All right, all those in,
Just, could you explain some of these special delinquency prevention programs, what the programs are?
The first one is for alternative sentencing. This is for youth that might be in trouble with the law, and it's kind of a diversion program. They will maybe work in the community through community action. There's various job sites, so they have to do like public service stuff. They get sentenced a certain amount of hours that they have to do. So they would go and, you know, do some work, say, like, you know, at a cemetery or something, like mowing or cleaning, or they might go to a church and do something there, those kind of things.
Okay, so it's set up by that agency?
Yeah, yeah.
Okay.
In fact, I actually used to be involved in that many years ago. In Glens Falls, we used to bring people to bring youngsters to various sites such as Countryside. We used to do work up there. We used to do work actually up in Hague at the cemetery up at Hague and the beach in Hague as well. We did work in Chestertown at the ski center there with the park and stuff, and a couple other places too. So it's a good program. It you know, is definitely worthwhile. The other one is home-based parent education. That's a supportive program to help parents better parent their children, to try to have a more structured environment in the home setting, and give them assistance and education that they might not have in regards to skills that are needed to you know, raise children. And sometimes some children, as we all know, require a little bit more attention than others in certain areas. So that's what that's about.
How do they get enlisted in that?
It's through various referrals. It could be through preventive services, through DSS, it could be through the courts, it could be through private providers as well. There's various avenues you might get involved in that. The youth and family counseling is similar to that as well, except it's more focused on counseling activities.
Thank you.
Thank you, Madam Chair. Chris, what's the relationship, or perhaps there is no relationship, but how are the services of the delinquency program blend, or could they blend with the youth court?
I'm not 100% certain how those are aligned. I wish I had my preventive services supervisor, who I was going to bring today, but she didn't come in until 9 today. I didn't realize that. But we can get back to you with more specific information on that. Okay.
We'd appreciate that.
The reason for the question is that the youth court, although some people may think it's a kids' court, it actually isn't. It's a bona fide court.
Yes, it is.
Trained, but it's run by kids. It's similar, goes along the lines similar to the Veterans Court. This is a court that's tuned in with the kids, children, youth, and has a pretty good outcome so far as recidivism. I'd be curious to see if are we duplicating services, or is this another population that really wouldn't fit into the services offered by the youth court?
Yeah, my guess is that they do work together, they collaborate on some level, but I'm unsure as to how that works. I haven't been directly involved in that myself.
All right, at your convenience, please.
Sure.
Thank you.
Absolutely.
Thank you.
Thank you. All right, all those in favor of this particular resolution?
Aye.
Opposed? Carried. All right, number 2.
Number 2 is requesting resolution authorization to submit to the New York State Office of Children and Family Services a resource allocation plan for 2018. That is outlined under number 2, attachment number 2, and on the back page is the breakout for each town within the county. This request is to continue the contractual agreements with Warren County Town and Municipalities to reimburse a portion of the cost for recreational programs. The funds are allocated annually to provide youth recreation programs throughout the county.
All right, someone like to bring that motion to the floor? Supervisor Leggett, seconded by Supervisor Sokol. Any discussion? All those, I'm sorry, Mr. Thomas?
Yeah, are the towns required to follow the OCFS guidelines?
I believe they are. As far as the programs and the spending of money on various items for the programs.
Possible to get a copy of it?
I will try and get that for you. You're welcome.
Any other questions? All those in favor?
Aye.
Opposed? Carried.
All right. The next item we have is the request to amend Resolution 237 of 2018, which authorized the extension agreement with Council for Prevention of Alcohol and Substance Abuse. This is for the youth court program. I believe there was a correction to this, and that's why we're bringing it forward today. And if you look at number 3, you will see that it has the correct contractual amount of $67,295. We brought that previously, but
Would someone like to make that motion? Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed? Carried. We need to go back to number 2. There were 2 requests here, and we only made one motion, so I'm not sure. Would we assume that our motion was for the first one or the second one? We talked about them both, but we needed the first one to submit the New York State Office of Children and Family Services Resource Allocation Plan. So that needs to be, let's do that one as a...
Did we, it was my understanding we did that one for the funding, but did we also approve the contracts? There's two resolutions here, correct?
One for the plan and one for the contracts. And we did one motion. So which would you... Pardon me?
On this resolution, request form number 20 there. Is that a whole separate resolution?
Well, he has two requests here. So in number 3, there are two different requests within number 3, so that's why we want to make sure that we've approved both of those requests.
Number 2.
One is for the resource allocation plan, and the second one was for the contractual agreements with the municipalities. So shall we say the motion we just made took care of the allocation plan, and now we need to make a resolution to approve the contracts?
I think we do, yes.
Okay, so I need someone to make a motion to authorize the continuing contractual agreements with the municipalities. Supervisor Loeb, seconded by Supervisor Leggett. All those in favor, or question?
All right, do we have actual contractual agreements, documents?
Yes, we do.
Thank you for clarifying that.
All right, all those in favor?
Aye.
Aye. Opposed? Carried. And Chris, on the next one, we don't really need an authorization for that. That's kind of just information to us because we get all that information into Amanda ahead of time, and I just have to sign the request.
Okay.
So you might just want to fill us in on that particular one, okay?
Thank you. The one number 4 that the chairperson is referring to is in regards to the New York Public Welfare Association Annual Summer Conference, which is in Saratoga Springs. This offers educational opportunities, workshops, and the like for management and attorneys from the Department of Social Services. They share information on new regulations, laws, and best practices that we bring back to the department to make sure that our workers are up to date on anything that might be regulatory or required from the department in regards to the work that we do there.
So you have 10 people that are going, Chris?
Yes.
Okay. All right, thank you.
Chris, if I may, the fees, the registration fees, is that inclusive of meals, or would there be an additional request for meal reimbursement?
There is additional request for meal reimbursement. So what generally happens is that the attendees will purchase lunch and they get reimbursed up to the amount that's allowed in that county because there is a maximum allowed amount depending on which county you're in.
Under the GSA rate?
Exactly.
Okay, well, we have to amend this request to include that. I'll take care of that when it comes to me.
All right, thank you very much. Appreciate it.
Supervisor Loeb.
Madam Chair, just a comment. We're fortunate that this is in Saratoga,
Right.
so that we can maximize the number of people that are able to attend. I'm in full support of as much training that
great.
we can give to our staff, so it works out well.
Yeah, it's an important event. We have one in the wintertime as well in Albany. The other good thing is that our attorneys get to attend certain workshops, and they also get continuing education credit, CLEs, for attending. So it's important to get as many people as we can there. And it's not overly expensive. Actually, once we get to a certain point, they do allow one person free, and there's some discounts as well. If you get it in before a certain period of time, we always make sure we do that so it's as cost effective as possible as well.
Very good.
Thank you.
All right. Next item.
I just have a couple things here, just some updates on some things that are going on over at DSS. In June, on the 7th, Julie Montero and I met with Ed from Countryside to discuss some issues regarding titles and duties, building issues, and some other issues. We talked about census, talked about sprucing the place up a little bit, and we did have some funds available for that, that we were able to use to get some plants and some chairs to make it a little bit more presentable, and that has been done, so
Good.
thank you, Ed.
Thank you.
On the 13th of June, I met with our Resources Unit Supervisor, Kate Livingston, to discuss some contracts that we have to get in order. I also met with Fiscal on that as well. It's a TALKS contract that's regarding income verification that our workers use in that area, and also to discuss some Medicaid and estate files that we need to figure out what the process might be going forward with our attorneys is. On the 14th of June, I met with our APS supervisor and senior caseworker, Julie Pearl and Tammy Corbett, to discuss some cases as well as our PCA contract, which is personal care assistant, part of the Consumer Directed Program. We also discussed what our legal process is going forward, because we really need to firm up how certain types of cases are going to be assigned to attorneys within the department. There's been a lot of, this one or that one, but we want to kind of get it in order so that our attorneys who might have specialized knowledge in certain area are handling certain cases, and if they don't, to start them on that route so that they really know what's going on with these kind of cases. In June, I also met with, beginning of June, I met with Lori Mosier. We have to work on a new policy regarding background checks for employees who have access to FTI, which is federal tax information. There's a new regulation coming out that employees who have access to that information have to have a criminal background check. So we're formulating a policy on that. We've already got some of that together, and now I need to go to Human Resources to figure out who's going to do it and what the policy will be in regards to advertising for positions, because I think we have to notify applicants that they would be subject to a background check. And we've identified the certain positions that will affect. The one question that we have is it going to be retroactive? Are people that are already working at the department going to be subject to these background checks? We still haven't figured that out yet. We haven't got an answer. On Friday, I met with Tammy Breen, who's our supervisor of Children's Services, and our two attorneys, James Lesbrunts and Gus DiStefano, in regards to contracts and our procedure, and how we're going to get those done in a timely manner this year. And I think we've got something figured out, so we've got a good plan, and we haven't had a chance to discuss this yet because Julie was off on Friday, but I think we've got a good plan in place, and we're starting to work on those for this coming year, the ones that start on July 1st. We also discussed distribution of workloads and formulated a policy and procedure for up-and-coming legal meetings with staff in various departments going forward. So, just a little update from DSS.
Very good. I think you've been working hard there, Chris, getting a lot of things accomplished. We appreciate that.
Thank you.
I guess it's on to Julie.
First, the overtime report, I did add year-to-date for the time period 2017 which we are quite a bit over in overtime compared to last year. Again, our CPS calls are absolutely crazy. We've had some staffing issues, we've done some hiring, three caseworkers in training, which accounts for the training overtime. So hopefully moving forward, eventually we'll see a decrease in that and get everybody up and running and at full staff.
Yeah, we're still short a couple of caseworkers, and we will have, of course, more training coming up. We have a couple of caseworkers also who have been with the department for a while now, working in that capacity, but they haven't been able to do various functions, most specifically the Child Protective Services Unit. So we have some shared responsibilities between caseworkers and other units, and they will also have to go to training as well. The issue with that is that the state has revamped its training program. Someone had pointed out earlier that the NIPWA conference was in Saratoga, which was close by. We are also very lucky that the new state training center is located in Albany. So instead of being out in Syracuse or Buffalo or Rochester, we're close by because what they've done is they've revamped the training so that everyone has to go to this training center. We're fortunate that we're close by. The people that are out in the western part of the state, of course, are wondering how they're going to get that done because other DSSs are experiencing the same issues that we are as far as turnover and training, and the trainings are becoming more and more intensive. So there's a lot of requirements. So we will be having much more training. We did have a caseworker list just developed from our civil service department. So we'll be interviewing some caseworkers as well over the next few weeks.
Okay, very good. Anything else, Julie?
Now with regards to the overtime,
Okay.
and then on the revenue and expenditure, I did add the year-to-date for 2017 or year-to-date 2018. And if you look, from last year to this year, it's very similar in both expenses and revenue. I'm not foreseeing any major issues at this time.
That's actually a pretty good column. Who has suggested that? Yep.
Chairman.
Chairman. Top notch.
All right, any questions from the committee? All right, thanks.
I have a random question. I know you mentioned the sexually exploited children the other day, and I was very curious about that. And I saw again here we have $30,000 allocated to a program. Can you talk about briefly what's happening?
I would say probably Chris. I went to the conference, and it was a conference basically that your staff put everything together, wasn't it?
That's correct.
Right. So I'll let you explain what
We got this grant, and we do have money left over. Currently, we're looking for trainings because we can spend this money on trainings. We can spend it on any informational type of programs. Currently, we are working with Lamar to do some billboards, so we're going to spend some of that money on that as well. I actually met with Tammy Breen last week so we could discuss not only that process, but other things that we will have coming up in the future. And she is working hard to make sure that we can spend that money that we got. So we'll be letting people know anything that comes up out of that develops.
Okay.
I was just surprised at your comment about how many children in our area
Well, I think it
are
was
being
just,
impacted.
well, there were like no specific cases in respect, but they were kind of pointing out that you aren't aware that this is what's happening, and it was just a very eye-opening experience to realize what really happens and as young as like 7 and 8 years old, which was really a scary thought. So, all right, thank you. Supervisor Conover.
I'm saying this for Brian as well, that if you go back, as Secretary, go back and go all action items before the board for the entire calendar year, then take those items which are recurring and commit them to calendar, and then those items that are specifically affected by state release, state approval, things like this here. Sometimes you can't move forward until state gives you authorization to move forward. They do allow some retroactivity, but it's running. Then you can move forward and you can back off to 30 days, to 60 days, to 90 days, and have it all on a calendar. And those things that are recurring, they just concentrate legislatively in a timely fashion. And if you're unable to meet that for some reason at the meeting, the county administrator will be in order. And I would advise that for all of the departments
thank you for that suggestion. And definitely approve efficiencies and information would be disseminated.
Your big department is committing that to membering, which is I have to remember to do the following.
Yeah.
With all of your other duties, good thing to have departmental calendar. It's easy for those things that are recurring, those things that come up on a day-to-day basis. I'm sure you will there.
Normally with this particular wrap, we have gone to committee earlier because usually the allocation has always been the same every single year. And so usually we have had it for like in January, and then the allocation doesn't come in until March, usually. And what we did one year, they did increase it by like $300. It was a minimal amount. We came back to committee just to ask to have it increased. I don't know, if there's something moving forward that we don't do, because that's why that one's coming so late, is we got the allocation really late this year.
On something like that, I mentioned earlier, that it's dependent on the budget being adopted. You don't have that information, so you don't know what the contract's going to be. Although the consultant will for the award, just commit some notes to your calendar in that regard, and then the county administrator is in a position to answer a question. How come this didn't come to us sooner? Or any, they would look at the calendar and say, well, we didn't get release from the state, or we didn't get the dollar amount on the contract until April 14th, and we couldn't move the contract until April 14th. And then the decision can be made. You can discuss it in the department. Do we move forward in January with a resolution based on last year's and then amend it later? Do a double duty, or then a decision will be made.
Thank you.
All right, Supervisor Garrity, I thought I saw your hand.
Get one personnel resignation.
Yeah, we did have a resignation of our Deputy Commissioner, Chief Legal Counsel, Cynthia Schrock-Seely, resigned effective June 1st. So we'll be also looking into how that's going to work as far as replacing replacing her with someone who will do those functions as well, and looking at how that will affect our attorneys, because she was also an attorney who did quite a bit of work in our department, especially in regards to helping our APS unit with those kind of issues. So, thank you.
So you're looking at a combined position again, deputy and attorney, or?
Not necessarily. I'm working with Human Resources and with Civil Service, and I'm also doing some research based on what other counties do in New York State, population-wise and department size, because I wanted to make sense in regards to how our administrative model works. I wanted to, I'm going to be discussing this with commissioners in other counties, as well as with Trish Nenninger, in regards to formulating what this will look like, whether we will have a director and another attorney, or if we'll have a deputy commissioner and an attorney. So right now we're just starting to decide what that might look like.
Okay.
We also have to keep in mind the cost factor, what's going to be the best course of action going forward to make things more efficient, to make sure that we are in compliance with all the various regulatory demands that we have from the state and federal government. Being in the position only a couple months, I'm learning that there's a lot of things that we really need people that are working very closely with the various departments to make sure that we are in compliance with various things. There are a lot of areas that I'm learning about, and I think that having a director that would have that kind of knowledge and would bring the skill set along with the knowledge that they would need for that might be a good way to go. So we're looking at that now.
Okay, and you'll just keep us updated then?
Absolutely.
Okay, sounds good. Thank you.
You're welcome.
I guess Edward?
Okay.
Edward, could I bother you? Oh, you have one. Sorry.
Short here.
Good morning.
Morning, Edward.
I don't have any action items today, but I did come to bring the overtime report and the marketing census report because I know they're important issues. So you can look over those reports. If you have any questions, I'll be happy to answer them.
Committee, any questions?
Thank you,
Supervisor
Madam
Loeb.
Chair. Just wondering, I'm not sure what the feeling of the committee is, but I'm wondering if we might consider, in this overtime report, eliminating the column of the net difference with the previous year. It's accurate, but because of the size of the numbers, it's a little distracting.
Just put your finger over that column, though.
I know. Well, you could do that.
What did you say, Ms. Bramer?
I said,
Don't
put
look
your
at it.
finger over
Well,
that
you
column.
could do that. I don't see it as a big issue, but Supervisor Garrity, you were going to say something?
Yeah, I'm concerned about a few of the holidays. I think we have a policy, in order to get paid holiday, they have to work before the holiday and after the holiday. That, are we following the letter of the...
We are following that,
We
yeah.
are, I mean, quite a high percentage off.
Well, just to give you a little bit of background, we've had some issues recently. Obviously, ironically, we were all very healthy during the winter, and then the spring came along and people were getting sick then. We also had a situation where we did have some people out for a while on workers' comp and disability. We also had a situation where, as luck would have it, the building is aging and things happen, and almost all the times when they happen, they're on off hours during the weekend. Now, our policy is if there is a maintenance issue, our staff will try and resolve it. If they can't, then I will try and resolve it. If I can't, there's no other option but to bring in our maintenance person to come in to resolve the issue. And I believe so far this year we've had like 11 incidents like that, and they all have happened on the weekends.
Maybe what we ought to do is identify what is maintenance and what is it's maintenance issue. That's or what is maintenance issues versus what is care of the patient care. Just want to make sure we have enough staff and have staff leave.
Right. Well, what we're doing, as I might have mentioned before, we have a strategy right now where we are currently training 2 per diem people. Okay, these are young people that we hired on, so they're young and energetic. They're willing to learn. One of them has been training for the past couple of weeks, or past week now. The other one will start their training tomorrow. When we get those people trained and all set to go, we'll be able to use them, in emergencies, which hopefully, I'm hopeful, will really minimize a lot of this overtime, because we will have more people available to provide the care. And most of the overtime, I don't know exactly what percent, but most of the overtime is attributed to care. But again, I mentioned the maintenance thing because, that's what's been happening. 11 times this year, every time on the weekend, and 9 of those times, it was an issue that
had the potential to affect care adversely. So we had to bring, our maintenance mechanic in to resolve the issue, rather than just keeping our fingers crossed, hoping we could get through the weekend on something that might have, been a real serious problem if we had not attended to it right away.
All right, thank you. Any other discussion? Did we check the census out on the back page? Just a minute. For the census on the back page, do you want you to check that out? Supervisor Conover?
Yeah, I just, I love Excel. Just check your formula on, I assume that net difference is between 5.5 and 591. So it's 4,200. That's the correct number. I'll stand corrected.
I'll double check. That's probably a total of that cost.
Yeah, that's what it is, a total, isn't it? Yeah.
Put your finger on it.
That was what you really want to know, I think, on that net difference from 17 to 18 on 12. The upper numbers give you the breakdown, but you really want to know what changed from 335 to 591. That's not 4,380%. Probably more like 7%.
Oh, I see what you're saying. Yeah.
7 or something.
Yeah, okay, all right.
It would make somebody believe what the colossal happened.
Right, okay, yeah.
Exactly, it's more like 75%.
Supervisor Braber has a question.
Thanks. Regarding the census, how much are we doing as far as outside marketing, and what kind of dollars are we spending on that?
Okay, well, I believe you all have my report that I emailed, okay? So, in addition to that, what I would say, a couple different things here. Last year when we did our research survey to the families, one of the questions we asked them is, what was the main reason you decided to come to Countryside? What was it that really sealed the deal, like you really wanted to come here? And overwhelmingly, the top answer was the tour. Going there, meeting our staff, looking at the home, kicking the tires, so to speak, that's what convinced them to go there, okay? The problem is, we don't have enough tours. Okay, just to give you a little bit of background, right now we're averaging roughly about 0.5 qualified tour per week. Okay, now that's not enough to offset our discharges. So if we could increase that, if we could just move that up to 1 per week, which is not a lot, 1 tour in a 7-day period is only like 14% of the time. If we could get to 1. Right now, our close ratio is about 80%. So like for every 10 tours we give, we get like 7 or 8 of them, okay? So if we could go from 0.5 to 1, given that close ratio of 80%, within a year, we'd be full. So that's one metric that we got to improve on. We've got to get more tours. We've got to get more people coming in the building. So basically, how do you do that? Well, basically, there are 2 things we're looking at. One of the things is that we've got to kind of showcase the home. Right now, most of our referrals are like word of mouth. I would say 90% of them are word of mouth. So we have to increase our referral base. We need more referrals from hospitals, doctors, home care agencies, funeral homes, insurance companies, law firms, bankers, financial planners. So right now, we're in the process. We've done some of it, but we need to do a lot more. Going out, meeting with those people, talking with them, giving them information, and then bringing them back for a tour. Maybe have like an open house. Maybe a group of the seniors from Cronin High Rise can come over for lunch, come in and see what we have. Maybe the political candidates, we could hold maybe a town hall forum for them there. Maybe the Rotary Club or the Chamber of Commerce could have some of their meetings there. We got to do more to get more people in to show everybody what we have. Other thing we need to do is we need to go out in the community, be more visible and more present, go to chamber lunches, go to different events. Social media and websites and all that are fine, but for the product that we have to offer, that personal touch is crucially important. So we need to pull more people in, and then we need to push out, going out in the community to do more. That way, people talk. I was at Countryside, and what a great place that is. People talk, and that would generate more referrals. Those referrals would lead to more tours, and those tours would lead to more admissions. So if we can tweak those numbers, we can get more referrals and more tours, the admissions will take care of themselves. So that's what we're currently working on right now. If anyone has any other suggestions or ideas, you know, I'm all ears.
Okay, Supervisor Sokol?
Thank you, Madam Chair. And it sounds like you're doing everything you should be doing, but in addition to that, I guess if I were looking for a home, I'd go online first of all. And it's kind of like looking at a home. You want to buy a home. They have these virtual tours. These tours are working for you. How about creating a virtual tour so somebody could click on it and just kind of get a good glance of what you have to offer? And then maybe at that point then they would come to get a real tour, but
Right.
at least they have something to view.
Yeah, you're absolutely right. The other thing they said on those surveys that we gave out is, you know, how did you go about shopping for this type of service? Pretty much everything everybody said right away was they went online to the websites of different homes. So what we did, we kind of enhanced our website a little bit. We put together some new copy with some of the bios of our staff, their backgrounds, their experience, and their skill, because that is our greatest asset, our staff. We put down all our selling points, you know, that we have. We put down a couple of recommendations, third-party endorsements from families. So all that is right there on the website. We probably do need to enhance it graphically with some photos and some, you know, different designs like the tree that we branded it with. So we'll be doing that. But you're absolutely right. That's where they start. The virtual tour is a good idea. We could look at that. My only concern there is that I don't want that to replace the actual physical tour, because that's the key. You know, that's a strong correlation, a real strong correlation between a qualified tour and admission. So anything we can do to get more people in, you know, coming for tours, looking for information, meeting our staff, having some punch and cookies with us, you know, that's crucial. That's what we really need to do. And I know it's a very time-consuming, involved effort, but we really need to do it.
Supervisor Loeb?
Yes, thank you, Madam Chair. Supervisor Sokol makes a good point. The virtual tour, more like a resume. You've got to get to people's eyes. And we do have tremendous resources in this county, of talent, audiovisual, that's Peter Gerard. We should take advantage of that and do it. And I agree 100%. Because that's where people are looking right now. They can't use a phone book anymore.
Right.
They don't exist. They go online. And that resume, that is something that's really snappy.
That would be great.
Now, come in and see us in real life.
Yep.
We have the resources to help you out.
Chris, we do have to kind of get this wrapped up because I do have another group in another
Worry about
meeting in
that.
10 minutes. So Chris,
You're
go
number
ahead.
one.
Just quickly, I would like to add, thank you Supervisor Sokol for that idea of a virtual tour. Perhaps we could put a link or something on our website and have that like on YouTube so that someone could go there and then they would be more inclined to maybe even go and see it. Real estate agents often use this to get people to come and look at homes. I think that's a good idea. The other issue that we have run into sometimes in raising the census is how does it get paid? Who's going to pay for it? Are they in county, out of county? So we've been brainstorming that as well. We've definitely lost a number of people who wanted to go to Countryside due to the fact that it just could not be paid for.
Now, is that due to the state regulation?
It is, well, part of it is, the other thing is that insurances, or if they're out of county, the county, say someone who didn't have a lot of resources lived in Washington County, if that person lived in Warren County, they would be able to get placed because we could access our Medicaid and other various funding sources. But if they live out of county, they're not willing to pay for someone to move out of their county because they would no longer be living in their county. So we ran into those kind of situations a few times.
All right. Anyone else? Supervisor Conover?
Yeah, I just want to mention, and I mean this in a positive way, I can remember a statement made some time back that the computer is not really how our clients, they're not very computer literate, it's not how they find us, and that, but now what we're realizing is it's a lot more powerful tool than perhaps we thought at one point in time. So my point to you is that it seems to me that the process that you're on now is giving you information get to a better place. And so I would encourage you to, continue in this process, continue supporting this process, because it means providing information that perhaps we weren't fully aware of.
Yeah, that's a good point. People that are getting to that age are more and more technically adept. I know, my own mother is on Facebook all the time now and going, to Twitter and this kind of thing. So people are becoming more comfortable who might not have in the past been, traditionally looked at as being tech savvy.
Well, I think
Catching up.
Edward has worked very hard at this to try to get those numbers up. I do know that, so we appreciate that. Supervisor Beatty?
Yeah, thank you. I hate to circle back, but I don't think you saw my MF.
No, I didn't. I'm sorry.
On the overtime, I know we're going back, but 76% increase over last year, it's $256. Do you know how many dollars that $256 additional from this year to last year weighs?
I'd have to get that for you.
Okay.
Yeah.
And then the second thing is, basically you're saying the reason why we have a 76% increase in overtime hours over last year is due to the fact that these instances of maintenance and so forth are occurring on the weekends. So I can assume then that next year's overtime report as a general statement be significantly less compared to 2018. The 2019 report this time will be significantly less, unless we have all these maintenance issues, which is out of your control, I understand.
Well, two points about that. Number one, there have been numerous reasons for overtime. Illness, workers' comp, maintenance, a lot of different issues. Going forward, the building is what it is. It's probably still going to have, some issues every now and then. But our strategy, our main strategy, is when we get these two people, these two per diem care aides, fully trained and ready to go, we will have them to utilize them, which we're hoping that will be the factor that will really get overtime down and hopefully keep it down.
Okay, you utilize them on the weekends or something?
Anytime. Yeah, anytime. Yeah.
So next year, knock on wood, we should probably see a significant decrease in the overtime hours.
Hopefully, in the next month or two, when we get these two people in here.
If you could just send me an email.
Sure, the dollar amount, sure.
Thank you.
Okay, yeah.
Ed, could I make a suggestion that to this report you just add 3 metrics? One would be the actual expense to date, 2 would be the adopted budget for overtime, and 3 would be the actual expense year to date last year, same period of time.
Okay, expense?
It's in your report.
Your report, Countryside is 63rd. So if you pay particular attention to that, it will tell you your budget, the budget. $120 is your salaries for overtime. The budgeted amount is $26,000. Year to date has been $10,997.
Okay. Thank you, Julie.
Now we're at 42% through May. So really, especially considering we had somebody out on workers' comp for a very long time. And then we had somebody else on disability for quite a long time. She's finally back to work. We've replaced the person on workers' comp. So moving forward, we are expecting forward.
Okay. Thank you. All right, anyone else? Yes.
Do you with Laker Chambers, your police already have, we have over 1,000 members? No, and if there's something either meet monthly, we came in that, so that everybody did that, because oftentimes we start seeing residents that want to stay, want to live here, and they need that resource.
Right.
Just to know more how to help.
Great, okay.
That's a very good idea. Thank you.
Thank you.
All right, Chris, Julie, Edward, thank you very much. You're all doing a
Again,
very
if you
good
have
job.
any ideas or other suggestions for me, just let me know.
Okay, will do. Thank you.
Oh, yeah. Well, get a kick out of the medical people that come in now and like, a little early. You're premature in your action there.
Thank you.
Yes, sir.
Good morning, ladies.
Oh, okay. Mm-hmm.
Any changes from what I already got?
What year they were made from. I'm assuming we need one.
Yeah, very, I don't think I could touch the...
Thank you.
You're welcome.
That's the only, no, I guess there's a second one.
Oh, wait, actually, that's the one I ran off.
See if the boss likes that. Well, it's right that you should be above everybody. That's good.
Oh, that was good. I'm on the edge of living on the...
You have to sit in this chair.
I'm good. It's really used to the feet. This is a humble position.
All right, Janelle, I think we're all set.
All right, good morning. We should be pretty quick today. We have 2 resolution requests. The first one is for a budget amendment, so if you want to refer to attachment 5, Tom will give us what we need to know.
This is just, again, additional funds we received from the United Health Institute for disparate money, and again, we apply that working on towards our new crescendo program that we're in the middle of. Go live this week with training for that for the home care. So this is just additional money that I was notified by the treasurers came in, so I have to amend the budget by $12,155.
I'll move that.
All right, second to that.
Second.
Supervisor Leggett, any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
All right, the next resolution request is to authorize the transfer of funds. Again, this is on attachment 6, and Tom will share what we need to know with that.
Pretty much all these transfers is within our bioterrorism. What it is we had an employee who was our part-time liaison, and then she got a full-time position with us within our public health effective the end of February. So because she's now considered full-time, she still does allocate some time towards the bioterrorism grant, so we're able to do that. So I had to go back to when she became full-time. The first amount for $3,671 is to transfer those funds out of part-time salary up to full-time salary, because that's where her salaries are coming from now. The second one is her salaries that we're anticipating. The new grant becomes effective July 1st. So we want to then move her funds from June 1st, when she's been where she's been working now, until the end of the year, and that's again moving it from part-time to full-time. And the third one is again moving fringe benefits like retirement, Social Security, and Medicare at this point, again out of part-time salaries down to the retirement, so that we can fringe and we can get that all, hopefully all squared away by the end of the year. Our anticipation is to try to get a part-time liaison working probably by fall. Is when we think the grant. She's still working as many hours and giving us some hours for the bioterrorism grant. So all this total $14,718 is basically moving money from our part-time salaries over to full-time and to fringe benefits and bioterrorism.
All right, Supervisor Sokol? Did I see your hand?
I'm just going to move that.
Okay, you'll move it in a second to that, Supervisor Loeb. Any discussion? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
All right, as far as pending items, we don't have any at this time. So for information and discussion and review, we have a report of expenditures and revenues on attachment 2 that Tom will discuss. Glad we brought Tom.
I was going to say, that's right.
Attachment to our financials as of June 7th. We currently are accrued, I just wanted to bring to your attention, we accrued in revenues, we had gotten in $173,538 for our early intervention program. That's a mandated program with the state. and that covers from July to April, up to April 18th, where they got that reimbursement, and it wasn't, the cash had come in, again, I was notified by the treasurers, but we just have to, they will approve that, and I added that to bring our revenues up to date. Our salary information, again, we're a little above in the regular salaries, and with our overtime and our part-time, we are down. As of this date, we are 35.12% of our budget, and compared to last year, we were at 40.91% of the budget. So again, we're looking good there overall. Attachment number 3 is our comparison of June 7th of this year to June 7th of last year, so you can see where we are. Again, we're down in expenses, and it is a big chunk of the change, and that's due to timing. I did look at most of the invoices, trying to do some comparison, did see where, you know, probably about a month where some things haven't been put in yet for this year, so that's why that's down a little. Revenues were up a little bit by $131,000 based on last year at this time. So right now, that's looking fairly good.
Very good. Supervisor Loeb.
Thank you, Madam Chair. We have on attachment number 2, the bottom part, the salaries, you do have the year-to-date for 2018 versus 2017. I guess we included that in an earlier report. That was an addition in an earlier report, which is very good. Can we add that column, a column like that for the expenses? Top part of attachment 2.
You would like, I'm sorry, what? Would it compare? Well, on the
Attachment 2, the expenses, we have 2018 budgeted, 2018 actual year-to-date. If we could have a comparison column for 2017 year-to-date, just as you do for the salaries on the bottom.
Okay, I can do that. I was going to say when
That's on the next page.
the attachment 3 does give you the comparison year-to-date for everything.
Yes, on the
It's
next
not
page.
just salaries, it's for all expenses, for our personal and equipment, our contractual, and our employee benefits. So attachment number 3 does show you the comparison year-to-date.
Right.
So you have an actual idea where we stood last year compared to where we stood this year. And again, if there's any big variances, I usually try to analyze that so you can understand. Like I said, with the expenses, this year, most of it was our preschool program, just with the timing. I could see last year we had already input some invoices for April, where we were, and this year we have invoices up to March. So that's where you're seeing some differences there.
Bill?
Sure. So we have 2 reports. Why can't we just put it in one report and add a couple extra columns?
Well, I'm going to honestly tell you, this report we never had before, Mr. Conover.
You're right.
and we do call it the Conover report in our office, that he had asked, could he see a comparison last year at this time to last year, or to the
So I think we're not going to get rid of it, or he might not be happy with it.
Well, no,
I was on the board
I'm saying
when-
there's no point in having 2 reports. Consolidated, it would be a lot easier to process the information. Because the information is good.
Well, we'll
That's
just
all.
leave it
Thank
that
you.
way for now. I think
Sure.
that's...
One thing on this report I do also is I do link this to my first report.
Right.
So all that brings it right in. If anything was to change, it brings it right in, and then I just have to do the information for the prior year.
You do a good job of that. I appreciate that. All right?
Moving right along, we have our emergency response and preparedness activities on attachment 1, just for your information. And status of referrals is attachment 4. If Val or Tammy would like to report, it looks like we're pretty consistent with where we were last month.
And that's 100% true. There's really not much of a difference. We did get a couple of more referrals this month than last month. But it still remained the same as minus 5% from above. So we're still very busy.
Yeah, thank you.
We did have one nurse that was out on medical leave, and she had surgery, and hopefully she'll be back next month.
Okay, very good.
With program updates, our early intervention program had a survey. IPRO was here on the 30th of May. We do anticipate some findings. At the time I wrote this, we were waiting on our official report, but at the end of last week, we did get our official report, so I'll be looking at that and
Okay, good.
figuring out what we need to do. We'll have 45 days to provide an official response. Also upcoming, the state loves us. They're going to be back on July 10th for our WIC program. So we'll be responding to that as well. Friendly fire, but it's good to know what we're missing so that we can kind of make improvements as we need to go.
Right.
Staffing update, staffing continuing to be a challenge, but I haven't asked for any positions at this meeting. We do have 2 nurses out. I did put on workers' compensation, the one that Val was referring to as workers' compensation. To clarify, we did have one out last week on disability, but I saw she was back today. So there were no intent to fill forms, and with that, I am done with my stuff unless there's questions.
All right, any questions from the committee?
I have a rando question.
Go ahead.
Okay. I know that the governor is proposing some Lyme research control plan. Do you guys know anything about it? Are you involved? Know what I got in the mail over the weekend? Yeah, I got that too, yeah. Which involved counties north of Warren County. And there's counties south of that. Why isn't Warren County involved in that? I'm not sure, but I had that on my list to kind of follow up with. Oh, good. Let's do that. I do know that our health education program is very involved with Lyme and doing programs within the community on prevention. So I do know that with our medical community, because there's a little bit of a discrepancy with the diagnosis and the chronic and the right. We provide information to the providers to try to help them sift through all the information as well. So we serve usually as a resource for the community, the providers, community organizations. So I do know that we're out there doing that. With the walking trails, we have some signs, like metal and plastic placards that we're able to give other groups, to try to help spread the word at camps and frequently used areas. But I need to check in for that question. Yeah, please do, because it sounds like there might be some money that didn't get included on, so can try to do that. First thing I noticed was Warren County wasn't in the little mailing, so. And it's up here. It's not like it's so cold that we're not having ticks. I mean, I don't know if that's the perception. No, we have ticks. Yeah. And we have Lyme. We do.
Yeah, exactly. Any other questions from the committee? All right, with that, I'll entertain a motion to adjourn. Supervisor Lowe, second by...
Thank you, ladies.
All those in favor?
Aye.
Opposed? Carried.
Good job.
Thank you for a good job. See you next month.